This software is meant for managing healthcare delivery and is designed to optimize output by clinicians. So in this demonstration, we're going to show you how to use this software to manage your lab operation. And I start with my login. Now I'm logging into the staff account, but a staff is enrolled into an institutional account. So whatever the staff is doing will synchronize with the account and database of the institution where he or she is working. So now I have chosen my staff ID and my password. I can also log in with my account email. That is the email attached to this account on the database. So once that is done, it will automatically sync with the institution ID where I'm trying to log into. So I click on login. When I log in and I have a new patient that has not ever visited the institution in question, I click on add patient to use this form to create an e-folder for the patient. But if it is a returning patient or patient that is already registered previously, all I need to do is to click on attend to patient. When I click on this, there are many options, but in this demonstration, I'm going to use the phone number option. So you click on get started on attend to patient via phone number. You put the patient phone number here, 08034891157. So this is the patient phone number I want to work in. Okay, let me see if this other one will go. I want to use this one instead. So this phone number without 7 at the back. So I click on verify, meaning I want to retrieve the patient folder from the database. So that I have done. So if I look down after this white portion, I will have a history of what has been done in the patient folder. So you can see all the previous tests done on this patient folder and so many other medical record of activity done on this patient folder. So clinicians can use this to work together in trying to optimize healthcare delivery for their patients, both in the hospital, in the lab, and in the pharmacy. So now I want to make new requisition of lab tests to be done. So I click on medical investigation. So under medical investigation, I have three basic type: lab, x-ray, and ultrasound. Though in this ultrasound, you will see things like ECG and so many other type of investigations. So you can see, let's check ultrasound. You see Doppler and you see a electroencephalogram. You see other types of tests like ECG, EEG, that are all there. So if I click on EEG, you see different type of EEG, ECG, you see different type of ECG tests. All right, but we are not bothered about that right now. We are about to run lab tests. So I click on this lab test. You see all the range of tests covered here: wider tests, microfluidic hepatitis, immunoglobulin and serology tests, parathyroid function, thyroid function, and kidney function tests. Okay, you can see there are so many tests: lipid, cardiac risk factor screening. A lot of tests to be done, but my interest is on prostate screening. Assuming I want to do prostate screening, and even peptic ulcer can also be done. You can see tests for all of that, and tumor marker too. This is for tumor marker. All the tests that you can do under tumor marker, that are all here. Then let me do prostate screening. Let's see how it goes. I select these two tests, though there's no price fixed yet by the institution admin. So let me just add that myself here. Then let me also add peptic ulcer screening. So I want to check for Helicobacter pylori antibodies. Let me do also polymerase chain reaction test, and let me do breath test. Okay, I selected all the tests I want to run, but they don't have any price fixed for them yet. So let me add price manually, just for us to see how the costing side of it works. That's why I'm adding this price. It won't stop me from running the test. Okay, so I have done all of that. I selected the test I want to run. Let me click on save. I have saved it. Now the next thing is for me to cause the test and do assessment. So that is under lab tests, and then these are the tests selected: peptic ulcer screening, prostate cancer screening. So, and that's the total cost of this test. Now there's what we call partner commission. If you have a partner that referred this patient to you and there's the amount of money you have to pay the person based on percentage, you use it to add that. So that is what I'm doing. It's optional input, but whenever you need it, you can use it if you have such. Otherwise, this will not even come up if you don't have partner set up in the insurance side. So I go to billing, that is the amount, it's paying out of pocket. I click on add item, that is done. So you can see the bill here. I save the bill. Bill is saved. So those in account department, the person can now go to the account department where he will pay for the service. So you click those in account department will click on patient bill management, and they will see the patient's name, Smith John, and that is the test you're going to pay for, 23,000. All right, so you click on pay received. So after the patient has paid the money, assuming he's doing POS payment or transfer, whatever is the option. So but in this case, I'm using POS. I click on save and I say okay, and it's paid. So I can print invoice for the patient. That is the invoice generated for this transaction. So that is the invoice showing the breakdown of tests done, the total amount of the cost. You can see the breakdown of tests, peptic ulcer, the price, the price total, and then the payment. And you can now print the invoice. You can see payment status paid. All right. So now it's time for the lab scientists to run the test. So those in the lab will now take care of that. So when you get to the lab to submit sample, and the test will be done, and they'll click on edit. When you click on edit, what is the specimen collection date? Assuming it's today, 2nd November 2023, and then assuming this test will be released today as well, 2nd November 2023. That is done too. Then Helicobacter pylori antibody test, let's say, is negative. Then polymerase chain reaction test is negative. Urea bread test is negative. So this is for peptic ulcer screening. Prostate cancer screening, we have 0.3. Then percentage free PSA, we have 6. And then if you want to summarize this result, you can do that here. Maybe you say result is normal. Here you also say result is normal. This is optional. Nobody is not for you to do this. Then who is the approving authority for this test? A second layer of control to make sure that the test is properly done. The person will approve by picking his name on this to sign it. Then you click on save, and then if you want to submit this result to patient folder, you click on submit. You say okay, you are submitting it to the patient folder so that clinician, once you log in, we see the outcome of the test without even having a physical copy. But now let's have a physical result printed. So I click on generate reports, and that is the result coming up. So you can see the result of this test, the prostate cancer screening, the peptic ulcer screening, and then you simply click on, it's already coming out as PDF, but if I want to send it to printer, I will select my printer from here and I will have it printed. So but let me save it as a PDF. I click on this, so it's going to my PDF. Let me save it on lab test samples, lab printout. Let me put today's date, 02nd 11/2023, but ideally I have to give it the patient name, maybe John Smith. Let me put it John Smith, so you can give it the patient name John Smith. John Smith. So you can now send it to the patient if you want to. So this is how you can use this software to run any kind of test you need in your facility. So if you want to deploy this software, simply get across to us on +234 08 +234 818 888 7036. I'll repeat, 0 +234 81 88 88 7036, or you call +234 813 904 2673. So any of this number, you can call us, or you come to our website and then healthserve.org. You get every detail to get across to us, and you can also sign up using the registration form on the platform, and you get onboarded, and we'll help you to implement it anywhere in the world. We are with you. Thank you.